MSNBC, we just made a decision to put up on the screen there some context as the speaker claimed that the president's quick action and leadership saved thousands of lives during COVID-19. Obviously, America leads the world in COVID-19 cases and in deaths, and we have one of the worst outbreaks on earth and have for months. Dr. Gupta, let me just ask you, as you're hearing this, what you think people should understand in terms of a bit of a reality check here.
Thanks, Rachel, for the opportunity. You know, a lot of that was hard to listen to. And this is not as a partisan, but as a clinician. Number one, for many weeks in the last 6 months, COVID-19, which we didn't even know existed towards the end of 2019, was the number one cause of death for Americans. Last week, it was the second leading cause of death for Americans behind ischemic heart disease. So to say that 170,000 souls lost in our country up to now is success by any measure is fantasy. It's disrespectful to the families who've lost loved ones, to frontline clinicians who put their lives at risk. It's just fantasy. It's propaganda. So that's number one. Number two, I would say the reality here is let's talk about PPE. We had to import insufficient, inadequate PPE, KN95 masks that did not meet any recognizable U.S. standard from China, from other places overseas, because we didn't have enough PPE in our strategic national stockpile. So for all your viewers out there listening to this, for anybody listening to what the RNC is doing right now, it's all propaganda. There's no truth to it. We didn't have enough PPE for our nurses, our respiratory therapists, or our physicians to care for COVID critically ill patients across the country. What about testing? We still don't have enough testing, Rachel. The right type of testing, the rapid point of care tests. That's why we're seeing testing numbers go down. That one of the lowest points has been in weeks. It's about 600,000 new tests a day, down from 900,000 towards the end of July. So that's important to keep in mind as well. And then finally, this notion that telehealth, the nurse that was just speaking about telehealth and progressive policies on telehealth, let me fact check that very quickly. This is the administration didn't suddenly invent telehealth and telehealth reimbursement strategies in the last few months. That's false. That is absolutely false. Up until the beginning of May, well into this pandemic, you needed a smartphone. You needed broadband internet access to actually communicate with a telehealth provider, someone like me, to order a test for a patient. It wasn't until the middle of May that they loosened restrictions so that you could get a test or you could communicate with the provider by phone. So let's be clear here about what's true, what's not true.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.